Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Today, we're talking all about our Gold Midwifery online conference, and I'm so excited to have Dr. Stephanie Langel here with us here today. And let me just tell you why I'm excited, because honestly, Stephanie, we've been talking a little bit about this offline. And we have been really nerding out about immunology. And I think that that is just so important. So breast milk immunology and the impact on neonatal health. It's a huge topic. And we'll get into it in just a moment. But first of all, welcome. It is great to have you here. Tell us a little bit where you are in the world and what you do.
Thank you. Yes, thank you very much for the invitation to come talk about what I do. I'm an assistant professor in the Department of Pathology and Center for Global Health and Diseases at Case Western Reserve University School of Medicine. I'm in Cleveland, Ohio, and my lab is dedicated to understanding breast milk immunology. And so that means the immune response of breast milk that comes from the mother is influenced by maternal factors and ultimately ends up in the neonate, affecting their development, growth, and immune response. So it is that connection between mom and baby through the conduit of milk. And it's amazing the amount of components that have immunological functions. I would say pretty much every component in breast milk has some immunological function. And I'm really excited to talk about that at the conference.
Yeah, I feel that when you start getting into like all the individual components, it's always feels like a wow moment for everything that's in breast milk. It has a purpose, and we're still discovering, I feel like all the time, what other things it might do or the complexities of how breast milk really stands up. Now, let's talk about, because we were talking offline about how to get this information from us, the professionals. And of course, you're going to be teaching us on the day. But how do we then get it into the hands of the parents? Because I feel like there's such a gap sometimes, little known in research. So we're still, you're fully immersed. So you're kind of the cream of the crop when it comes to, all things immunology and breast milk. But I'm trying to get it to the families. Is this something that you hear about too? I mean, you probably have peers and, colleagues that, they start, really geeking out on it. How important is the decision making having an impact when people have this information?
Yes, and I can speak from a personal experience point of view. So in 2020, I gave birth to my first child. I just had my second child 4 months ago, and I'm in the lactation groups on
Sure.
Facebook and educating myself on the non-immunology side, right? On all the
Right.
other things that
Yeah.
involve in breastfeeding. And I think it's key to be able to translate what we're learning in the lab and making sure it gets out of the lab into the hands and the
Hmm.
brains and the ears of those who you work with on a daily basis, because our breast milk is immunologically designed for our neonates. And I'll
Hmm.
talk about that in the presentation. We have a very unique composition that comes from us that is meant to benefit the baby itself. And so we have to identify those things so that we can give women the option with a with full understanding of what their breast milk contains. And if that means, that person would then decide maybe to breastfeed longer or to push through troubles, that they're having, that's great. Or if it means women who can't breastfeed, can we design formula or other alternatives to human milk that could substitute all of the things that we have in breast milk? So I think that's twofold, making sure that people who want to breastfeed know how important it is, obviously, but what immunologically is happening. But then not everyone can. And so we want to give them the same benefits. So
Sure.
we have to learn how to repurpose some of these things that we're finding. So I do think it's really important, and it can get lost sometimes in terms of
Hmm.
like the basic science of it.
Yeah, absolutely. Yeah, the uniqueness, of course, we've known for some time. I feel like it's been a lot of surface talk though. And we go back and forth with, well, we know breast milk is good, but that has produced a lot of, shame and guilt in the community.
Sure, sure.
Like you said, there's families that really struggle with breastfeeding, can't breastfeed, and so forth and so on.
Yeah.
Even accessibility, I think, to human milk, could change the trajectory of this if people knew like the long-term value. Is this something that you study too? Are you looking at like the whole picture, the long term? What
Mhm.
sort of studies do you have there?
Yes, so we're definitely interested in how breast milk kind of imprints on the
Mm,
baby and then changes, or alters a trajectory over the
mm,
course of life. Really
right.
is what we're, the full life is what we're interested in. But and
Yeah.
yeah, and to go back, I do want to pinpoint, you're right, because even an accessibility issue, but even if people just for mental health reasons, they just don't want to, you know what? And that is totally their right to do
Sure.
so. So
Yeah.
I think in our lab, trying to identify both, so I think of them as like short-term and long-term benefits. So the short-term benefits are development in those first couple weeks of life, or if you have some type of acute infection. But what's been really fascinating, what really is the forefront, is how breast milk can help seed the microbiota or the bugs in the
Mm,
gut of the baby that we are finding the microbiota can really change and alter overall health for the long term. And so it's not, breast milk is not just about fighting the bad guys out there, the bad pathogens, the
right.
bad bugs, but it's about actually helping to solidify the good guys, the good bugs, the
Mm,
microbiota in the gut of the infant so that they are able to grow and develop in the way that they should. So it's definitely looking at things long term and short term. Yeah.
mm. Yeah, I really appreciate that. I just think the information is so interesting. So I'll tell you quickly, the conversations I've ever had about immunity and, the impact and the foundation, like you said, the microbiota that really is impacted long term. When the women, the parents I sit with, they hear this, I mean, they're mind blown. They
Oh,
start to
wow.
go,
Yes.
wow, this is amazing. I never knew. And so all of a sudden the value shifts,
Sure.
in whatever decision making that they are faced with, because again, it is really all about informed decision. It's not who's doing what, when, or where. It really is about getting the information to the people. And I think informed decision making starts to shift the criteria. The value might go up for them. And I think that's really the key. So, I mean, from a clinician to you, I just say like kudos. I mean, the
Oh,
work that you're doing is like really superior in the world of health right now, because we really are fighting the long game. We're looking at
right.
long term
Right.
how we can prevent illness.
Right.
And if that in fact is impacted, we do know, I don't think it's an if, but how that's impacted and what we can do to
Right.
preventative medicine has always been the key. And
Right.
I think you would agree to that, right,
Yes.
Stephanie?
Yes, definitely. And yeah, I'm looking forward to, I'm going to give, like you said, not just, I mean, I'll have big picture stuff, but we're going
Sure,
to get
sure. Yeah.
down into the details and I'll
Love
explain,
it.
what are the experiments that we're doing in the lab? What is the evidence that suggests that this is,
Hmm.
how mom's milk is specific to baby and then that impacts long term. So we'll go over all of that and hopefully you'll
Sure.
come away from it. People will come away from it feeling like they're a little bit more of an immunologist than they were before.
Perfect. Well, it's going to be so good just to really get into that, learn what's happening, what's new, what we've learned over, the last sort of even 10, 20 years, as we've gotten more and more research, which is really, really exciting. Thank you so much. Thank you to you, and, send out all that love to your team. I
Oh,
know that
sure.
they're working hard to,
Yes, yes.
bring things together. And I know that you send accolades to them as well. Your presentation is by far, just so full of science, and I love that. But do not be dissuaded by this. Stephanie is such a great knowledge translator herself, and I know you're going to enjoy and really learn, like she said, about what is happening with that breast milk in the short term and long term, and the impact that it can have, in our health. So it's going to be really a great and important presentation. Thank you again for joining me here today. It's been fabulous having you.
Yes, thank you very much. It's been lovely.
Look forward to, quizzing you some more on the day. Of course, Stephanie will be here live. We'll have a live Q&A And also you'll have an opportunity to ask questions of her. She's also, of course, it'll be recorded presentations, so you'll be able to jump on at any time for your convenience. There's forums that are available so that if you do have questions offline, you'll still be able to ask them. You can head over to our website right now at goldmidwifery.com with all the information that you need for this particular presentation. And then, of course, our midwifery conference, which begins very soon. Come to our open keynote. It is live and open access. And again, everything is recorded for your convenience if you just happen to be not available on that day. But register now, that's the key thing. You'll get all the updates of what's coming up. A big thank you once again to Dr. Stephanie Langel for being with us here today, and have a wonderful rest of your day, everyone. Bye-bye for now.